Hi, and welcome to Kent State University College of Podiatric Medicine. My name is Archana, and I'm a fourth-year student. I'm from Houston, Texas.
Welcome to my favorite place over the last 4 years. My name is Morgan Gallo. I'm an outgoing fourth year from San Diego, California, and I'm here studying to be a podiatric surgeon.
This is our administrative office area. Here you'll find any help you need with financial aid, applications, enrollment. These are the folks that will be helping you out throughout your application process and your transition here to Kent State.
Down this hallway, we have our Director of Academic Services and Institutional Research, David Putnam. He's going to make sure you pass all of your boards and get to graduate as a licensed clinician. Over here, we have Teresa Novak's office. She is our academic researcher, and this is the woman you want to see if you inevitably struggle with classes. But I promise once you graduate, you'll know all the material. In here, we have our quiet study room, where you can study all your academic undisturbed.
This is our library, and this is Donna, our librarian.
Hello, welcome to the CPM library. Our library is a complete medical library. We're here to serve the podiatric students, and we have lots of traditional and non-traditional items that the students can use. For instance, we have bones that you can check out, entire skeletons. We check out things like headphones and whiteboards and markers. Or you could go the traditional route. We have books and journals. We have a lot of electronic resources, so our students are able to get electronic resources when they're either off campus, at home, or out on clerkship programs all around the country. We're here to help them and support their needs.
So down this hallway, we have some study rooms. We have 3 study rooms that can be used here in the library. They're on first come, first served basis, so there's no sign-ups or anything like that. It's a great place to study as a group, great place to review before exams, quizzes, anything like that. Here we have some of the current medical journals, specifically pertaining to podiatry. All of our lectures are recorded on a system called Boxcast. It is a live streaming service, so as soon as class is happening, you're able to watch from home or wherever you're studying. For example, in the library, you can watch them at 1x speed, or sometimes if you're feeling really enthusiastic, you can watch them at 1.5 or 2x speed to get through lecture a little faster. It is important to note that it is your responsibility to still go to classes because things do go wrong with Boxcast sometimes, and it is your responsibility for any material that is covered in class. But it is a great way to review for exams, review for boards during that time in your second year, and also to keep up with material that you were unable to be in class for. I personally like studying at home or in the library at my own pace. When I do watch lectures on Boxcast, I'm able to pause, take notes, edit lectures, whatever that I need to do to prepare my notes to study for exams. But again, your responsibility to attend class.
Actually, I had a really interesting transition. I didn't have to study in high school and undergrad. I never really struggled much academically until I came to Kent State, because for the first time in my life, I wasn't able to just take an exam without studying and doing well. And I struggled a lot my first year. I actually failed one of my classes first semester. And I reached out to representatives on campus like Teresa Novak, both in the therapy department and in the academics department, and they helped me to come up with a study plan and to sort of readdress my academic plan of action, so to speak. I was hooked up with a personalized tutor who worked with me on a one-on-one basis and in a small group setting multiple times a week, and I'm proud to say that as a fourth year in my last academic semester, I was on the dean's list with an over a 3.67 GPA. Get the help you need here.
That's a great time to talk about tutoring. So first year, we offer tutoring services for all of our major classes: anatomy, genetics, what else?
I really struggled with anatomy. Micro is a big one, yeah.
So we have weekly tutoring sessions where your second year peers will hold sessions in the anatomy lab and walk you through all of the structures that you need to know, and just to prepare you for the practical aspect of anatomy as well as the lecture material. We also do tutoring for micro and genetics and all of those classes where they're more lecture based, but the second years do a great job of breaking it down and just making it more understandable. This is our simulated patients lab. Here, the school will hire actors to pose as patients so that we are able to practice and hone our clinical skills. This is an example of an exam room that we will be using. It's a fully equipped podiatric medical exam room. And then over here, this is where we get to practice our medical skills.
Over here we have Doug and Jeff. Doug and Jeff have helped many of our students learn how to practice certain types of aspects of medicine that you might feel uncomfortable practicing on a real patient for the first time. In here I learned how to do intubations, cardiac chest compressions, and start an IV before having to use those skills on other patients. As a podiatrist, we actually get to rotate through a lot of other fields of medicine, including emergency medicine, family practice, dermatology, and rheumatology. And so it's important to have a fundamental knowledge of all the system settings, which is something that you could absolutely and will absolutely learn here at Kent State. The common ones that you don't really get to rotate in as a podiatrist would probably be like OB-GYN and neurology. But podiatrists are licensed physicians. There's only 3 professions in the country that are considered physicians: DOs, MDs, and DPMs. And as such, we are expected to know things about all systems in the body so that we can treat and help our patients with whatever issues they come into clinic with, help to refer them in the right direction. So having a fundamental knowledge base in all systems and all areas of medicine is really fundamental to what we do on a daily basis.
So once you've seen your simulated patient, you will come down here with one of the doctors, one of the attendings, and when you are seeing your patient, you are being recorded, and you'll be able to watch it on this TV up there, and the attending will be able to give you any critiques or any ways that you can improve your patient skills.
Over here, computer labs, great place to study as an individual or as a group. You can meet some really great people in there. Down here on this side, we have technically our quieter study pod, although it doesn't always happen that way. A lot of people kind of set up shop in there throughout the year and spend so many hours in there, they call it a second home. And in here we have our group study rooms and our relaxing meditation study pod.
This is our meditation room. All of the students and staff on campus have access to this. You have 30 minutes in here, and it's a first come, first served basis. So you can come in here, set your timer for 30 minutes, and go in there and contemplate and reflect on your day. It's a great way to take a pause in your day from all the studying that we do and just take a moment to relax.
I'm like actually getting rid of 4 years of stress right now.
So we have a massage chair that we can use. We have what are those? Zen garden and a relaxing fountain. This is our student organization room. In your time as a student here, you'll have the opportunity to participate in one of our many student organizations on campus as a way to enrich your academic career and as a break from studying. Some examples of organizations that we have here on campus include the Pediatrics Club, the Sports Medicine Club, surgery, and we also have sports organizations such as basketball and soccer. These are some of the trophies that our teams have won in the past, and it's a great way to get a break from studying and just to get your mind off of school for a while, and a great way to bond with your fellow classmates as well. All of our professors here on campus are very accessible and always willing to help. In a little while, we'll walk past their offices actually, and anytime they have office hours, they're happy to help if you have questions about class or just podiatry in general, anything that you need, they're always there.
Building relationships with your professors as a graduate student is just somehow inherently different than when you were in college or high school. You're working here with your future peers someday who are really truly here because they want to help promote podiatry, they want to teach you to be a good doctor, and they're really fundamentally deeply involved and invested in your success as a student. I've made some really great friends here that are professors. I have multiple, I have some of their phone numbers, and I'd venture to say that we hang out. It really is great to kind of develop these personal relationships with them. These are the people you'll be asking for letters of recommendation, for job references, to kind of help you as you transition as a student into a young doctor.
This is our radiology lab. Here we learn how to interpret radiographs and also how to shoot them. As podiatrists, we're able to read and interpret and shoot our own radiographs, which is unique to our profession.
I just passed boards part 2, which is the last boards requirement for graduation and the start of your residency.
This is our practice room where you will learn how to position patients as part of your third year radiology rotation.
Yeah, uniquely when you get to clinic, you'll actually take x-rays and even CTs down at we have the CT machine, right, down at Midtown, where you can actually take radiographs and computerized tomography on patients in real time. Interpret the results and provide a diagnostic back to the patient, hopefully within an hour. The worst place to scrub into your first surgery is in the OR room. Here at Kent State, we have our own surgical skills lab where you can practice all sorts of techniques and skills that will be utilized in patient care in the operative setting.
So in here, this is our mock OR room. We can practice important clinical skills such as using a bone saw with sawbones. You'll practice placing tourniquets on patients. That's an important skill to learn as a third year. You'll also learn about all the different surgical instruments that we use in podiatric surgery, the names of them and their uses. You will also learn how to gown and glove in here as well, which is another important skill to have before you go into the OR. Ew, my nails are not painted.
In here, we have the podiatric skills classroom where you will learn techniques important to doing exams on the lower extremity.
We practice on each other, and that's how we learn to hone our podiatric medical skills.
This year is the first year where we're actually doing intramuscular injections in addition to nerve blocks. One of the pushes is to allow podiatrists to do all types of injections in the clinical setting, including vaccinations.
So this is our bone room. We have tons of sets of foot bones in here and leg bones. We have tutors in here, a few hours a day that you can come in, and they'll help you learn about the bones and the different parts of the bones. That is an important aspect of anatomy first year. The bones that we do have in here, they're actual bones from cadavers that have been donated. So they are a great learning tool and very indicative of what you will be actually seeing in a patient when you do surgery.
Caution, radiology in practice over here. This is where we shoot our x-rays on our patients from clinic. And to your right over here, we have our state-of-the-art histology and microbiology lab, where as a first and second year, you will work to identify pathologies and strains common in bacterial and viral and fungal infections.
As a podiatric medical student, it's important to learn patient care skills early on. This is why here at Kent State, as a third year and a fourth year, we have a rotation here in our fully functional podiatric medical clinic. Bedside manners are something that patients really value, and so this is a great place to learn how to communicate with your patients and really empower them to take charge of their own health. So these are our classrooms. This specific classroom is where you'll be for your second year. So this is the first year classroom. Should you choose to come to Kent State University College of Podiatric Medicine, this is where you'll spend all of your first year. This is where we have lectures, we take tests in here and quizzes.
On the topic of choosing where you go to podiatry, here's my one plea that I'll make to you. I did travel to a lot of the other schools, and they are all great, and no matter where you go, you'll get a great quality education. But my past 4 years here, as I'm preparing to graduate and looking back, have been the best 4 years of my life. And I was one of those people who was miserable in high school and college. This is a place I never want to leave. I will for sure be sobbing as I walk across that graduation stage. And I can't wait to hopefully someday come back here and teach students just like you.
This is our cafeteria. We have breakfast and lunch that's served here. There's funds allocated from your tuition.
This is our anatomy lab. As a first year, you'll be assigned to a cadaver along with a small team of other students, which you will utilize to assist in your knowledge of human anatomy and structure.
Each of our anatomy tables are equipped with a computer screen that you can reference anatomy atlases, any reference material that you need while you are working on your dissection. The prosector table is additionally equipped with a camera that projects to the TVs up above the tables, where you can follow along with the instructor as you dissect. Yeah. You'll spend a lot of time in this lab as a first year, whether it's during class or after hours catching up on dissection, studying for exams. It is a rigorous, challenging, but a very rewarding class as well, and very important to us as surgeons to know our anatomy. And first year, during the first half of first year, so first semester, you will dissect from head up till the pelvis, and then second semester in lower extremity anatomy, you will dissect the pelvis and below all the way to the toes. Usually there's about 5 to 6 students per cadaver, so there's plenty of work for all of us to go around. And in lower, that number gets a little fewer, so there's 2 limbs per table, so about 2 to 3 students per limb. Thank you for coming on this tour with us. Good luck on your applications, and if you need any help, don't forget to reach out to our school and our staff. They will be willing to help you out any way they can. They can also put you in touch with one of us or our student ambassadors that we have here on campus should you have specific questions.
Depending upon where you are in the application process, one of our academic counselors or academic advocates will reach out to you soon to answer any remaining questions and help you along with the process. We hope to see you next year.